I'm Dr. Scott Greenberg, and I'm the cardiac electrophysiologist with the Woodlands North Houston Heart Center. So the Watchman is a procedure that we use to protect patients against stroke in the setting of AFib. So atrial fibrillation is the most common abnormal heart rhythm on this planet. And in reality, the biggest danger to atrial fibrillation is that it increases your stroke risk. There are really two ways to prevent strokes in the setting of AFib. One is with blood thinners, and the other is with a procedure called the Watchman. So traditionally we start people on blood thinners, and unfortunately there are some people who just aren't able to tolerate blood thinners, whether they've had issues with bleeding, whether you're just concerned about a fall risk, or there's other medical issues that might come into conflict with being on long-term blood thinners. So for those people, we have another option, and that is the Watchman procedure. Essentially in atrial fibrillation, what is happening in the heart is the top left chamber of the heart is fibrillating. So instead of the nice, what we call sinus rhythm, normal rhythm, where the heart beats like this, boom, 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 this top left chamber is fibrillating. Problem with when your heart's fibrillating is that it doesn't move around blood like it should. And when blood doesn't circulate as well, it can form blood clots. There is one area in the heart that typically forms the majority of blood clots in the setting of AFib, and that's something called the left atrial appendage. The left atrial appendage is a little sac that hangs off the top left chamber, and blood likes to pool there and form blood clots. If a blood clot ever forms in that area, and it gets kicked out into the brain from the heart, then that is what causes a stroke and AFib. So the Watchman's a procedure in which we're able to implant a device into that sac, let it expand, and occlude that area of the heart. The good news about that is that not only is that area occluded, but you only have to be on blood thinners for a short term afterwards, typically about 6 weeks. There can be a lot of issues with blood thinners. If you have recurrent bleeding episodes, you end up in the hospital. And then if you take people off blood thinners who are chronically in AFib, the biggest danger is the stroke. So, it can really get you off the blood thinners to prevent recurrent bleeding, but also prevent you against the danger of AFib, which is that stroke risk. So in a way, it tackles two issues. So traditionally, we've been stuck with surgical options to get rid of that left atrial appendage, and surgical options require surgery. So a lot of the times there's an incision that is made in the chest where you can go in there and you can either clip that area, sometimes you can tie that area off, but a lot of times that was reserved for people who are undergoing other open heart surgery. So the benefit to the Watchman is that it is really relatively far more or less invasive than the open heart option, and the fact that we can go through really the vein in the leg, and we're able to place this device up through the heart, cross over to that left side of the heart, and we can place this device, let it expand, and detach it. This is a lifelong deal. So, essentially we have another cardiologist in the room with us who's actually doing the imaging as I place the device to make sure that it forms a good seal on this appendage, because the appendage is different shaped in every human being. It's really like a fingerprint. And once that device is detached, it's there. And then it takes about 6 weeks or so, a few months, for tissue to grow over that device, so that we can get you off the blood thinners, and essentially that area of the heart is blocked off from forming blood clots. Well, I think it provides a lot of confidence and reassurance in the patient. We're going to have a prime example here shortly with recurrent bleeding episodes, and just kind of the fear of the unexpected, knowing when the next bleeding issue is going to happen, or what happens if we take you off the blood thinner and you have a stroke. So it really is a novel device, and it really is a great option for a subgroup of our patients.
Cliff Peabody.
And mine's Jean.
My experience was I had problems which I don't remember, and then I was explained about the Watchman. My age, I guess, was some fun for them because I don't think they had that before. I can think of nothing that bothered me, hurt me, or gave me any concern once things got underway. Had a beautiful nurse, a nice doctor, And I thought, what else do you need? And really, that's my experience of just gaining, gaining a little strength back. And, uh, and I think I've done that now, and life, quite frankly, has become totally back to normal.
My experience was he's himself again. Before, he had reached the point where when he went out to the mailbox and back, he had to sit down. Uh, we had an episode where he ended up in the emergency room and they had to give him 3 units of blood because we were concerned about falls and what if it happens again. And the blood thinner was a problem mentally for me. He doesn't care. He just goes. But he is back to himself, uh, obnoxiously so. He does yard work. He's willing to argue about. I was used to being boss for a while and I've lost my bosshood. So it has been a life changing thing for us. Remember things. The staff was very caring, very good about explaining each step to the best of our kindergarten mind knowledge. And we had total trust. He did spend the night, but primarily because of his age, I believe they wanted to make sure. And he just got better and better and better once we got back home to, it took a couple of months to get full stride, but we're a good salesman. How does it feel to go back to your normal obnoxious self?
Uh, Good, as a matter of fact. Uh, People that like me still like me. People that didn't, still the same way. So as far as I know, there's been no particular change. Made a few more friends. Uh, because of it, had a little more fun. But to me personally, they told me what was going to happen. I purposely asked him not to give me too much detail until it was over. That's personal, I guess. But had total faith in everything that I was told. As far as I know, it happened exactly that way. Couldn't have been nicer people. Uh, and as far as after the surgery, I, everything, all of my recollections is top notch.
I would tell the wives, look out. If you want to stay boss, don't do it. If if you want your real husband back, go for it. It's worth it.
I don't think life has changed for when you've, the age has changed just quite a bit. But as far as that's concerned, I don't see of any particular to talk about change. Oh, here it comes.
More energy, uh, less, oh, I don't care, whatever you want to do, let's do it. He initiates activities now. He's got his old, old get up and go back. And we both figured, after you're 90, that's just how it is. But it wasn't.
I married a younger woman.
He lies.
Typically what we see in Watchman patients are, blood thinners, they really are great drugs. They are very well tolerated. In the past we were kind of stuck with a blood thinner called Coumadin, and Coumadin in itself had its issues with chronic monitoring and watching what you eat and watching what drugs you're on. Recently we have these newer generation of blood thinners called DOACs, which you're able to take and not have to monitor those levels and whatnot. But in the end, all the blood thinners do have the side effects of blood thinners are bleeding. All right. The perfect patient is, we traditionally look for people who are at an elevated stroke risk. So we use scoring systems to kind of base a yearly stroke risk off. So it's those who have some of those risk factors for stroke, and typically congestive heart failure, high blood pressure, age, diabetes, prior stroke, and you have to meet a certain score on that scoring system to be a candidate for the device. And then really it's those patients who are active and we want to get off blood thinners just because they are not able to tolerate them, but are at that increased stroke risk. Now the procedure in itself is it's essentially a procedure that takes I would say on average about an hour. All right, it's done under general anesthesia. And essentially what we do is we get access to the femoral vein, which is a vein that kind of sits right on top of your leg. And we are able to deliver the entire device through that vein. And after we detach it, we are able to pull the delivery system out. And the only thing that you have left there is a suture that typically sits there for about 6 hours. And after 6 hours, we're able to take that out. And really afterwards, there's no incision. You don't need to worry about how you bathe. It's a very simple recovery, and the fact that you really just have to take it easy with that site for about a week, and then after a week you can really go back to normal activity. So typically after you come in and get a Watchman, most people go home the very next day. In fact, there's some people who actually go home the same day these days. So after a Watchman is implanted, the patient has to come back 6 weeks later to re-image the device. And we can either do that with a CAT scan, or we can do that with something called an echocardiogram, which is an ultrasound of the heart, to evaluate the device and make sure there's no leaks and that it's forming a good seal. If there's a good seal, at that point we can take the patient off the blood thinners and we switch them to something called dual antiplatelet agents for 6 months. And then after 6 months, the patient only has to be on a baby aspirin forever. So being on lifelong blood thinners is certainly an issue for a lot of people, whether you have side effects or there's bleeding episodes. But it really it causes a lot of anxiety knowing that people always worry about what happens if I injure myself, what's going to happen and whatnot. So getting off the blood thinners really provides a lot of confidence and reassurance for the patients. Well, certainly it's a peace of mind, the fact that not only has it gotten off the blood thinners, but the biggest concern we always have about AFib is the stroke risk, and being able to protect yourself from the stroke without being on these medications is more than peace of mind. It's really life-changing.